Welcome to our interview series with WellNest Global and international holistic experts, Consilience, Exploring New Ways of Thriving. You can find this series on our YouTube channel at WellNest Global. I'm Valarie Angle Roberts, your hostess today, and our intention is to empower you, our audience, with tools, wisdom, and resources to assist you in your journey of thriving in this life. Today, we have with us the founder of Competent Heart Perinatal. She is a doctor of physical therapy, a doula, and a pelvic health expert, Tina Harris. Welcome, Tina.
Thank you so much. It's great to be here.
We're so happy to have you. I've been excited all morning reading about you and learning more. And I'm so excited to have this super relevant, important conversation with you. So go ahead and take it away. Tell everyone who you are, what you do, maybe a little bit about how you got into it.
Absolutely. Yeah. So I'm Dr. Tina, as she mentioned, pelvic floor physical therapist and doula. Those are kind of like I would say those are my main gigs because I always dabble in a little bit of extra stuff. But I have been a physical therapist for the past 10 years. And when people ask me, like, how did you know that you wanted to be a PT? And I said, it would just really came to me when I was probably in middle school. I was like, yeah, I want to be a physical therapist. I used to want to be a vet. And then I was like, you know what? I realized I don't only work with cats and dogs, like snakes and frogs and things. And I'm like, I'm not that person. So I still love just like to help people and to see like where people start off and then where they end up during the whole rehab process. And I love to witness that transformation and that transition. And physical therapy was the perfect avenue in order to do that. And when I got into it, I realized like how vast the industry of physical therapy is. It's basically like if anything is going on with the body, there's a PT for that, basically. And then while I was in PT school, we had like one itty bitty section for women's health, which is what it was called back then. I was like, we go through so much. I know there's more to it than this. So being like the lifelong learner that I am, I went ahead and explored on myself. I took myself 6 hours away to shadow a women's health physical therapist, and seeing her in action, I was like, yes, this is exactly what I want to do. And my focus to be on pregnancy and postpartum, because that's always been a really strong passion of mine. And so just as I've gone through the years, I've just really honed in my skills and focused on that pelvic health aspect, realized like how much good a pelvic PT can do, but also like how much society doesn't talk about it and how much, our world doesn't know about it because, it's hush hush, we don't talk about what's going on down there. That's private. And yes, it is, but it also is things that a lot of people are experiencing and dealing with. And because we're not talking about it, people feel lonely and they feel like they're the only one going through it. And so they don't say anything and they suffer. And I really want to, kind of nix all that in the bud, like take care of it, help people to just have the awareness of what pelvic health is and knowing that there are things that can be done to help them along the process.
Awesome. Yeah, you're right. It's so important. It really never even crossed my mind until a couple years ago. A friend of mine went through something that brought it to my attention. And at least around half the world, we're women, right? And there's things we need to know and do about our reproductive system and our body. And it's kind of silly that it's taboo or, under talked about. But like I know with my mom, with her mom, my grandma, it was like my mom, they sent all the girls to the school when they were like in the 10th grade for a talk with a doctor about their period. Like the parents didn't even have that conversation with them and they didn't want to talk about it when they got home, right?
Wow.
It's so strange. And that was only, that was, I guess, 50 years ago now. But that's not that much time really. So yeah, hopefully now we're coming into an age of more free conversation about these very normal topics.
Mm-hmm.
And people can start to feel connected and supported and normalized with this kind of stuff. Exactly. So what is this what is the biggest topic that comes up, and what is kind of like your passion and what you do?
Right. So when it comes to pelvic health, I'll just put this out there because a lot of people have that misconception that pelvic health is only for women, but everyone has a pelvis. right? So our mind normally goes to women because a lot of things happen in our pelvis, pregnancy and periods and, all those things. And that's definitely true, but also men experience pelvic health issues too. And so I've had many talks with even my husband, just like, you might want to go see somebody. They're like, well, what can they do for me? I was like, well, go and find out. There's so much. They don't neglect the men's health aspect. Like men don't neglect your health also, like everyone needs this work too. But I do in my work, personally, I do focus on women's pelvic health. So women and maternal pelvic health. So the pregnancy, the birth portion, because I am also a doula, and the postpartum. So I kind of brought in my pelvic PT and my doula skills, married them together, and really help that to really empower folks as they're going through this childbearing journey. Because during pregnancy, we hear this messaging a lot. It's like, oh, but you're pregnant, we can't do anything with you. There's almost like this fear of like, I don't know what to do with you. You're in this kind of state where I'm just going to do very little, be very super conservative. And a lot of people take that to heart. And it's like, well, I'm experiencing this pain, but I can't do anything except pop a Tylenol. That's a whole other subject. um, and, and just have to suffer through it. And I'm like, no, there's so much that you can do, and you deserve to feel good during this season. Like, I feel like pregnancy and birth is really sacred, and we've lost touch with that. And I wish that we can just really tap back into a lot of these holistic methods to really support our health and our well-being throughout the entire lifespan. And so my big passion is really like increasing the access that folks have to pelvic health, to the education, as well as pelvic floor physical therapy. Because here in the United States, we have like what we call as direct access to physical therapy. However, with pelvic floor physical therapy, a lot of us are out of network with insurance. And that's another topic too. But so that creates this barrier for people to get access because they want to use their insurance benefits, but we may have out of network benefits, or you might have to pay out of pocket. And so it's this whole kind of thing. And so a lot of people are like, well, I guess I can't do it. It's not for me. Or the doctors aren't referring to pelvic therapy. So I was like, well, my doctor didn't say anything. So when I don't know about it, or if I heard about it on TikTok or something, I still can't get access to it. And so that's why I love doing like talks like this and going out into the community and educating folks. It's like, okay, this is what it is. This is what pelvic health is, what you can do to educate yourself, advocate for yourself for sure, and prevent and maintain, pelvic wellness.
Yeah, I love what you said about the situation with the insurance and the medical system and all that. And I think for me, like now at this phase in my life, I'm 48. I didn't know these things in my 20s, maybe when I was first having kids and stuff like that. I wish I did. But your doctor, your medical system, that's a conversation. And
Mm-hmm.
so people go into that and they're like, oh, it's a one-way street. Doctor tells me. And when you talk to doctors and doctors and have them as friends, they'll tell you, I'm a specialist in this area. I'm not a specialist in every single area. And I'm certainly not a pelvic health expert or a pregnancy, pelvic floor expert. And so that's why that conversation back and forth is so important. And people have to advocate for themselves, learn from you, take that to their general practitioner or OBGYN and have a conversation, and don't feel like it's a one-way street that the doctor just issues this mandate and this is what has to be, because they may not really understand what you're going through, or they may not realize that there are resources available to help you with something
100%.
like that. So
Yes.
really good point there. And that, just because something's not in network or not covered doesn't mean you don't need it. And
Right.
typically, people like yourself will provide some kind of education or resource, even if you can't afford to do a full on package, you can
Mhm.
still get some kind of guidance and support. So thank you for that.
Right.
Um,
Absolutely.
so what do you spend most of your time working with? Do you spend a lot of time working with women in pregnancy and postnatal? Is that the majority, or
Yep.
educating?
Yeah, most of it is the pregnancy, even for like a little bit fertility through, pregnancy, birth, postpartum. And I say postpartum is forever. So postpartum encompasses a lot of people, so it's not just those first, like, 3 months or 6 months after birth. Postpartum, especially if we're not taking care of anything, initially after postpartum, it can extend years and decades. Those things can linger on years and decades down the line. I've had someone come into the clinic, her son just graduated high school, and it was the first time addressing, scar tissue from a cesarean or other procedures, and really addressing her pelvic health postpartum. And so, I always say it's never too late. And it's never too early to go ahead and assess your pelvic health, reach out to a therapist, and get the help and support that you need.
Are there specific red flags that a woman might overlook typically, like that women are like, maybe this is just part of being a woman, or, those things we're told, like, just suck it up. It's just part of being a woman, or it's what happens after you have kids. What are some of the most common red flags that you think women overlook and don't seek help for that they really should?
Yeah, so many, because so many, because in society where those things are normalized, we're taught to normalize it, and like you said, suck it up, and oh, it's normal, kind of thing. And my thing's like F normal, like I'm not here for normal. I'm here for healthy, ideal, for optimal, to be able to live my best life. So one of the things that I hear people that complain a lot about is heavy periods and like cramping and issues with the menstrual cycle. And, we're maybe told to, go ahead and get on birth control, or, take some pain medicines or whatever that case may be. Another thing is like back pain is really common, and leaking, so like bladder leakage, urine leakage, when you cough or sneeze or laugh or jump or anything like that. And that's one of the biggest ones. And you see the commercials on the TV all the time, wear these, these underwear to help with your leakage, which all of it's doing is just catching it. It's not helping anything. But it gets normalized. It's like, yeah, if you've had a certain number of kids or you reach a certain age, it's normal to leak on yourself. I'm just like, no, that's not. It's really not. I would say it doesn't matter if you have 50, 11 children or if you're 160, like it's not normal body function to leak on yourself. There may be some things going on function wise that can be addressed. Maybe there are some underlying conditions that might be contributing to that. But in a, ideal body, our bladder shouldn't be leaking. We should have that control. Our muscles in our body should have that control in order to keep us dry until we're ready to let it go, kind of thing. So those are like the three main ones that I hear a lot.
Yeah, I can totally resonate. We have these conversations in my friend groups about all of those things. So yeah, I can believe that. Yeah, super common stuff. And again, like if you don't have close friends or family that you can talk about, people, they probably aren't. They're just ignoring it and like, be normal. I'm just not gonna say anything.
Right. Yeah. Yeah. And the most times I see it is like on social media, get on Facebook, and especially in these groups, people are saying, oh yeah, I've got this going on. And everyone in the comment there's like, oh yeah, it's normal. It's normal. Or we make a joke about it. And it's like, oh, ha ha ha, I've got that too. And it's like, okay, you laugh so you don't cry, but then let's go get some help, So all of those things and so much more are things that pelvic floor physical therapy can help with and is very effective in helping with.
Okay. So for you, a doctor of physical therapy, a doula, pelvic floor expert, what are some things that you probably are aware of and do in your life or recommend regularly that the typical person, typical woman, probably should be doing on a regular basis? Are there certain um, activities, exercises, movements that we could improve to just improve our overall pelvic health in general?
Absolutely. And that's the way that I approach it, as well as like I like to give people practical things they can do on their day-to-day basis that doesn't take an hour, of exercising to do. Because for me personally, if you gave me an exercise program for an hour, I'm probably not going to do it. I'll be very honest. I'm a terrible patient. But if you give me tips on how to incorporate it in my life and do regularly, okay, I can make this a habit now. So my very favorite thing is, and the first thing I do with all of my patients when they come in the clinic, is breathing. Teaching how to breathe properly. A lot of us don't. A lot of us are these shallow chest breathers, or we're holding our breath during certain things, and that can cause a whole host of issues. But like really taking just even I say 5 minutes, but even just a minute of intentional deep breathing to cleanse the system, to calm the mind, calm the nervous system. I see it in clinic all the time. Like people come in with super tense pelvic floors. I guide them through a minute or two of really intentional deep breathing. Pelvic floor relaxes right then. I've done nothing else except they are just breathing and they feel safe and calm and comfortable. And there's changes in the body already. I'm not saying that's the only thing I do, but like that's the starting point. And then just having them just really incorporating that and encouraging that throughout the day. And then I also, for me personally, I love doing release work of like tension in the muscles. So I like playing with balls. So I like to say it's like, big yoga balls or tennis balls or, massage balls, those things that I use because I do hold tension and most of us do hold tension in our muscles, in our shoulders and in our hips. And so I have balls all over the place. My sons get into them and they're like, oh, you throw the ball. I was like, that's my my exercise. Stop playing with it. But yeah, I just really like using simple tools that I can find, wherever to really just help to support pelvic health. And then my third favorite one is steaming, pelvic steaming, and that I have used personally to regulate my own menstrual cycles because I would have very irregular, heavy cycles with lots of cramping. Like every month I thought I was pregnant because it was late, it was always super long. But then when I started incorporating steaming, then very next cycle was perfect. Came and went, hardly noticed it, was there, and was just like, this is beautiful. Like, this is what I've been missing my whole life, not having to be on birth control and putting all these things into my body to try to regulate the hormones. But all it just needed was just a little boost and a little help. And so, again, those kind of holistic and just everyday tools around that you can find anywhere to really help boost your pelvic health because pelvic health is everything. It's every day, it's involved in everything that we do. And so you can find little things here and there to help facilitate and support that as well.
Yeah, definitely something that you don't want to wait until you're in an emergency state, in a triage state to get help with.
Yeah.
Talk a little bit more about how can people learn more about steaming and what you offer in terms of that and that kind of support, because being in the holistic realm, I've heard a little bit about steaming. A lot of our boho hippie friends in the mountains here love to do like steaming retreats and things like that, but it's really moving toward normalization and people hearing about it in I guess more mainstream sort of way. So tell us a little bit about that aspect and how you support people in that.
For sure. Yeah. So I love steaming. I went ahead and got certified after I had my own personal experience with it. But I really love it because it's like the intro to pelvic health. It's a really great self-care tool. Can take 10 minutes a week, in order to take care of yourself with a steam plan and program in order to address a multitude of pelvic health issues. And so I created a resource because I use it mostly for like um, helping to regulate cycles. I created a resource where you can basically like read your period cycle, like what symptoms do you have throughout your cycle and during your period to know what imbalance is going on in the body, because any pain, any symptom that we're feeling or that our body's expressing is our body's way of communicating with us. And the same things, like our periods are like a vital sign. Okay. You want to know what your blood pressure is and your heart rate. Like really pay attention to what your menstrual flow is telling you. But if we don't know what it means, then we can't do anything about it. So really bringing awareness to that. So I have a free resource for people to be able to do that. And then we can also jump on a call to create your own custom steam plan. Going through, the reading and intake form and really what your goals are and developing a plan to know like how often you need to steam, what herbs are going to be beneficial for you. Do we need to, how does the setup need to look? And so we get on a 1 hour phone call, video call like this to be able to do that. I also send you the custom herbs that you need, a 1 month supply, so that you can be able to facilitate that at home for yourself, in the comfort of your own home whenever it feels good for you.
That's so awesome. Thank you so much. I will we'll be sure to put the free link in the description. If you're listening to this, conversation while you're driving or walking or something like that, don't fret. Just come back to WellNest Global on YouTube and we'll have these links for you. I will share Tina's link for that free STEAM resource and the call, as well as other ways to get in touch with her and learn more about her too. Amazing. I just feel like I've learned so much in this short little conversation. And I know it's a huge value to our audience. I'm already thinking like, okay, I'm going to send this to my daughter when I get off. And I'm going to send this. So I've got this list going of who I know needs to hear this. And
Yes.
yeah, so please share this one, y'all. It's so important and relevant to, like you said, really everybody, but particularly in your case, women, pregnancy, postnatal, et cetera. But yeah, such good information. Any final words, Tina, that you want to leave everyone with as we close out regarding, your expertise?
I would just encourage everyone to go ahead and schedule your appointment for a pelvic health consultation, appointment, evaluation, just really knowing your status, knowing where you are right now. So I mentioned pelvic health is involved in everything. I've coined the term P's and Q's of pelvic health just because it's like this overall function of pelvic health. It incorporates pee, poop, penetration, pain, posture, pregnancy, postpartum, all these different P's. So if you go on my site, follow me on social media or anything like that, you'll see I talk about it all the time. It's just this over encompassing how much pelvic health is involved in our daily lives. And so just really know where you are. Don't wait until things are like glaringly obvious. Just go ahead and check. If nothing's going on, if you're tip top shape, perfect. Go on about your life. If not, at least you can start the journey of healing and really taking care of yourself from the get-go.
Yeah, and that's what the holistic journey is all about, just connecting to your mind, body, spirit, community, financial wellness, all of that to live your fullest life. So thank you so much for being here today. So wonderful to meet you. Glad to be connected,
Absolutely.
and can't wait to share this out with our audience. Yeah, so appreciate you so much, and everyone who's listening or watching. Make sure you check out all of Dr. Tina Harris's links below in the description to the video, the free resources, the information, and get started on that pelvic health journey. Thank you all for being here today and learning and growing with us at WellNest Global. And make sure you subscribe so you don't miss this video or any other ones like this on our channel. Have a great week, everyone. Bye-bye.
Thank you. Bye.